wonderful episode here, Jaws Podiatry. Today, we are performing a trifecta, a little bit different, but we'll go ahead and use the name trifecta. We're doing a trifecta procedure on a patient who recently presented to our office with a tendinitis or a tendinosis, which has been present for 6 months in duration. Anatomy 101. There are two very important tendons here. They're called the peroneal tendons. They start here, they move here, and then they make a U-turn here. There's the longus and there's the brevis. The brevis is a short one, and the longus actually makes a quick U-turn here and dives into the bottom of the foot. The brevis. So the brevis, right, we have 5 metatarsals, 1, 2, 3, 4, and 5. This is the side view of the 5th metatarsal. And the peroneus brevis tendon inserts, right, it attaches into the base here, okay, of the 5th metatarsal, also known as the styloid process, okay, or the, again, the base. So my recommendation, because this is a chronic problem, I recommended procedure number one, microtenotomy. Microtenotomy, also known as the acupuncture technique, deep dry needling. Procedure number 2, the platelet-rich plasma injection. And procedure number 3, an ozone injection. Okay? So without further ado, we will start off with the microtenotomy, okay? And we're gonna needle only this portion, right, of the tendon. If you feel any discomfort, please let me know, patient, okay? How does this feel? Pain?
No.
Okay, good. So here we go. Pain?
No.
Good. Okay. This is called blood. That's normal. It's a joke. Okay, and that's exactly what we do. The purpose of doing this, just like I was explaining to the patient, this procedure, whether for a tendinitis or a fasciitis, or the plantar fascia, tendon, soft tissue, works great. The purpose of this procedure is to basically draw more blood into the affected area, which is what we need in order to obviously heal this area. Discomfort here?
No. Yeah.
Okay, we'll stop there. Okay, that's all we need in respect to the tenotomy. Percutaneous microtenotomy, acupuncture in lay terms, deep dry needling. Let's go to procedure number 2. Okay, we isolated about 3. We don't need that much. Okay. So what I like to do is, okay. Do we have a good view there? So again, this tendon basically inserts in several places, right? Over here a little bit, over here a little bit, and over here a little bit. Most of the skin is right here. So what we're going to go ahead and do is slowly infiltrate. Patient, how are you doing now?
I'm fine.
Any discomfort, patient?
No.
Okay, good. So, slowly, and the reason is, as everyone knows, for the people that have watched our previous videos, PRP could be uncomfortable. We have already anesthetized the area. We're just infiltrating PRP here on the top. We're marinating the entire area. Just very slowly. The reason why, why slowly, because we want to make sure that we keep all that PRP. Discomfort, patient? A little bit. How about now? Tolerable?
Yes.
Okay. Now what we're going to do is, this is all of the insertion, right? We're injecting the insertion of the tendon at the base. And now what I'm going to do is, I'm going to inject a little bit. Now, the discomfort that the patient is feeling a little bit of discomfort now, and it's probably because of here. It's not probably on the bottom here. There is no anesthesia, so he may feel this dull, achy pain now a little bit. But I want to also marinate the area that we did the tenotomy. Any pain, patient?
A little bit.
But from before or right now? It's hard to say.
I have to think.
Hard to say. Okay, we're almost done. So I think that's, we've infiltrated a good 3 cc's. Okay, we're done, and you can actually see. I want everyone to see this. Come around. So you see these 2 little areas that are blanching. That's what this is uncomfortable. This is not. There's no anesthesia here. Okay. Okay. And last but not least, save the best for last. The procedure number 3 is the one that doesn't hurt. This is actually just gas. So what do? I'm here, not here. So we'll take this, just like this. This is an ozone generator we showed everyone the other day. Now we got it. So again, medical grade oxygen, 2 molecules. We want ozone, 3 molecules of oxygen, O3. This is a generator. We're going to generate ozone, passing the medical grade oxygen through the generator, and what's going to come out here, right? Okay, this is on. Put it at 12. 1 second. Okay, I want everyone to look at here how it is. Okay. So now, the grand finale of the trifecta. There is gas in here. This gas in here is ozone. 3 molecules of oxygen. And what I like to do, and that's it. Voila. Done. So the reason why I inject it the way that I do is for it to spread on purpose. It spreads. Okay? We're done. Recap. Are we still friends? Okay, good. Now we can continue. Recap. Trifecta procedure for a peroneus brevis tendonitis. For all intents and for, we'll just keep it very simple. A tendonitis of a very important tendon in the foot. Plays a major role, an important role. What we did today, procedure number 1, the percutaneous microtenotomy, also known as the deep dry needling, the acupuncture. Procedure number 2, the PRP, the platelet-rich plasma injection. Procedure number 3, last but not least, the ozone injection. This trifecta procedure is wonderful. When we talk about outcomes for chronic conditions, this works phenomenal. Our job is to heal patients. Our job is not to have patients come and go, right? To come and go. Our goal is identify a problem, treat the problem, and stay friends with our patients. Like always, www.jospodiatry.com, Instagram, Dr. Tojan,